Hello friends, in this video I am going to teach you how to identify right ventricular hypertrophy on ECG. So there are diagnostic criteria to identify RVH on ECG. First one is there has to be presence of right axis deviation. And then there has to be dominant R wave in V1, lead V1 that is of more than 7 mm or RS ratio of more than 1, and dominant S wave in V5 or V6 that is more than 7 mm deep or RS ratio of less than 1, and QRS duration has to be narrow that is less than 120 milliseconds. So other supporting criteria are there has to be right atrial enlargement like P pulmonale and RV strain pattern that is ST depression and T wave inversion in precordial leads V1 to V4 and lead 2-3 AVF, or there will be deep S wave in lateral leads that is 1 AVL and V5 V6. So what are the causes of right ventricular hypertrophy? Causes for right ventricular hypertrophy includes pulmonary hypertension, mitral stenosis, pulmonary embolism, and chronic lung diseases. That is called carpulmonale, and congenital heart diseases like tetralogy of Fallot or pulmonary stenosis. Then arrhythmogenic right ventricular cardiomyopathy. So these are the causes of right ventricular hypertrophy. So let's identify RVH in a given ECG. This is example 1, ECG number 1. Let's see what happened here. So in any given ECG, you have to start from standardization and rhythm rate axis. So let's calculate rhythm here. So there are P waves, QRS, P wave, QRS, P wave, QRS, and RR interval is normal here. So this is sinus rhythm, and there are 1, 2, 3, three boxes around 100. Heart rate is around 100, so normal. And axis for axis determination, you have to see lead 1 and AVF. See, in lead 1 QRS is predominantly downward, and lead AVF it is predominantly upward, so both are reaching each other. That means right axis deviation. So after that you have to see waves. The P wave is normal, QRS looks normal, T wave looks normal in lead 2. Next you see lead AVR. What happened here? There is predominant R wave. So dominant R wave in AVR, that is one criteria to call it as RVH, and there is right axis deviation. So this is first criteria, dominant R wave in second criteria. Next in V1, see what happened here V1. There is also dominant R wave in V1. So that is 3. And there is ST depression and T wave inversion in lead V1, V2, V3, and somewhat look like V4 also. So this is right ventricular strain pattern. So these are all criteria which are suggestive of right ventricular hypertrophy. See, this is normal sinus rhythm with normal rate with right axis deviation. There is dominant R wave in lead V1 and EVR, and there is RV strain pattern. So these are all suggestive of right ventricular hypertrophy. So let's look at the another ECG. Second ECG. Here rhythm is okay. P wave QRS, P wave QRS. RR interval is regular. So normal sinus rhythm with the normal rate 1, 2, 3, 4. So around 75 is the heart rate. So the axis is predominantly downward in lead 1 and predominantly upward in lead AVF. So there is the right axis deviation, that's one criteria. Then there is a AVR, there is predominantly dominant R wave in AVR and V1. That is second criteria, and third criteria, and there is RV strain pattern. This is associated criteria. So this is also suggestive of RVH. So what are the findings of this ECG? Right axis deviation. And one more thing that I have missed is, see, you have to see waves. What happened to P waves here? P waves looks like they are tall. So these are tall P waves, or nothing but cor pulmonale or P pulmonale. So this is one more thing. So right axis deviation, P pulmonale, and see what happened here. There is kind of right ventricular, right bundle branch pattern. So that is incomplete RBBB, and there is RV strain, that is ST depression and T wave involving lead V1 to V4. So this ECG is suggestive of cor pulmonale. So hope you like this video. Thank you.